Initiative for Health Accountability and Transparency welcome you to Leadership, Management and Governance Module 1, which is on the health system. The outline of this presentation basically is on the concept of the health system, the components of the health system. It will also look at the functions and objectives of the health system, and also look at the health system's thinking, the characteristics of a functioning health system, social determinants of health, and finally the challenges and the emerging health system issues. The objectives of this module is that at the end of this module, participants were able to explain the concept of the health system, describe the components of a health system, explain the functions and objectives of the health system, explain what is meant by health systems thinking, describe the characteristics of a functioning health system, discuss the social determinants of health, and also highlight some challenges and emerging health system issues. It is not unusual for you to see people lamenting about the poor health outcomes, and most of the times we attribute it to weak health system. Therefore, strengthening the health system is a priority of health systems reform in many countries. A strong health system is very vital for scaling up service delivery, for improvement in health outcomes, and also for achieving universal health coverage. What is a system? There are everyday common examples of systems in the human body and in engineering. In the human body, we know about the cardiovascular system, the respiratory system, the reproductive system, and many others. And in engineering, particularly in mechanical, we talk about brake system, talk about the lighting system, we talk about the fuel system, and many more. These are examples of a whole complexes that consist of several parts and elements that have to be present in a whole and must work together in a well-connected and interrelated manner to be effective. The system, therefore, is a group of interconnected and interdependent elements or parts forming a complex all, and the complex all will not be able to function effectively unless all the parts are present and they are well connected and well interrelating. If we apply the same principle to health system, we can assume that the health system consists of several parts or elements that must be present. They must be interconnected. They must be interrelated to work together to be effective. A health system, therefore, consists of all organizations, institutions, the people, the actions, and many other items whose primary intent is to promote, to restore, or maintain health. Beyond this, it also consists of the laws, the policies, the strategies, the plans and programs and activities in general. What are the different parts of the health system? We said earlier that a system consists of several elements or parts, and they must all be present, and they must be well connected, and they must be interacting in a way to be effective. In the case of the health system, we have what we call the WHO Health System Building Blocks, and there are 6 of these blocks. The first is service delivery. The next one is health workforce. We also have information. This information relates to health management information system. We have the medical productions, vaccines, technologies, infrastructure, equipment, all of them in one go. And we also have health finance. And the last but not least is leadership and governance. All these are designed for specific aims and they have desirable attributes. And they are very key to access, to coverage, to quality, and to safety. And the overall outcomes, when all these are present, is improved health status in level and equity, improved responsiveness to the needs and demands of the populations, social and financial risk protection. Usually these guarantee financial fairness and also improve efficiency. Now, we'd like to look at these functions and the objectives of the health system. The first thing is to note that there is always a difference between the health system functions and health system objectives. Basically, there are 4 key functions of the health system. The 4 key functions of the health system are, the first one is stewardship. And what does stewardship means? It includes the task of defining a vision and direction of health policy. It also encompasses exerting influence, and through what? Exerting influence through regulation and advocacy, and also concerns collecting and using health management information. The next function is creating or generating resources. We must note that any level of a health system needs a balanced variety of resources to function. And the resources include physical assets, it includes consumables, supplies, it includes human resources, it includes knowledge and information. The third function is financing function. And in general, financing deals with mobilization and allocation of funds to cover the health needs of the people. And it includes revenue collection, fund pooling, and purchasing of services. And finally, but not the least key function is service provision. The hallmark of a health system is service provision, and it involves mix of inputs that are needed for the production process that will lead to delivery of health services and interventions. Good service provision usually is characterized by access to service, to continuity of service, to comprehensiveness of service, that is, it encompasses promotive, preventive, and restoration, and also coordination of care, because we know there are multiple layers of care, and these layers should be well coordinated because they need to be well linked, particularly with reference to referral services. We should note that the performance of the health system is determined by the way these functions are organized. We've looked at the functions of the health system. Now let's look at the main objectives of the health system. You can reflect, what do you understand by the objectives of the health system? And if you can put 1 or 2 or 3 down, please do that before we get to next slide. Now, looking at the 3 main objectives of the health system, the first and foremost, which everybody will talk about, is that the health system is key to improving the health status of population. It's key to lowering the morbidity and mortality, and is also key to reducing inequities and inequalities. The second function of the health system is that it protects the population against the financial risk of health problems. This is very important because most families, particularly in developing countries, are just a step away from poverty as a result of illnesses. And the final one is responsiveness to citizens' demands and also the needs of the citizens. The relative importance of these objectives shifts with changes in demographic and epidemiological trends, what we call health transition. Because we know as we move towards the right transition, each of these objectives becomes more and more important. For many developing countries, the focus has been on the first one. Today, we are shifting attention to financial risk protection and the issues of responsiveness to citizens' demands and needs, including issues that have to do with medical ethics and the rights of the patients, is becoming most fundamental. Having looked at the functions and objectives, we need now to understand the relationship between the health system functions and the objectives. This diagram shows the relationship between the functions and the objectives we have just highlighted in the previous slides. We looked at the stewardship, we have spoken about creating resources, we've talked about financing, and you can see how they relate to delivering services. All the first three are key to service delivery, and they are also key to objectives of responsiveness. They are also key to objective of financial fairness, and all of them are key to improving health status. Now let us look at health systems thinking. What is health system thinking? It is the application of logical insights to understand the elements, the parts that we have mentioned that influence health outcomes. It is also about models, the relationship between those elements, and authors design, process, or policies based on the resultant knowledge in order to produce better health. Like we said earlier, each of those parts are key to better health outcomes. And the health systems thinking approach is the use of systems perspective. We talk about various elements that must be well connected, they must interact. So, use of system perspective to understand how health system building blocks, the context and actors act, or how they react, or how they interact with each other in designing, in delivery, and evaluating health services and interventions. A system approach thinking places high premium on understanding the context and also looking for connections between the parts, the actors, and processes of the system so as to modulate them to be effective. Let's look at the dynamic architecture and interconnectedness of the health system building block. At the center of all the parts or the building blocks is the people. And we have mentioned the various components. So for health system to be effective, all these must be present in a manner that is sufficient and adequate to provide effective and functional health system. It is often said that health systems thinking is a sound choice. And this remark was given by Margaret Chan, the former WHO Director General. She said that healthcare delivery has commitment we are all committed. Everybody in the health sector, irrespective of your professional background. The political leaders, to some extent, are also showing some commitment. The policy makers are also showing some commitment. There are also resources, and there are powerful low-cost interventions everywhere. However, the power of interventions is not matched by the power of the systems, that is the capacity of the health system to deliver them to those in greatest need on an adequate scale and in time. This is very key to our work when we aspire to strengthen the health system. Systems thinking is actually an approach to problem solving that views all the problems as part of a wider dynamic system, and also it is a tool for diagnosing organizational issues and understanding change dynamics. What is most important and most fundamental is that system thinking is very useful for strengthening the health system. We have talked about the health system. You will also often hear people talking about the healthcare system. We need to understand if there is a difference between the health system and the healthcare system. You can make your opinion and note it down. There is no difference between the healthcare system and the health system, or there is a difference between the healthcare system and the health system. The definition of a healthcare system is an organized social response to health conditions of the population. An organized social response to the health conditions of the population. Compared to the health system, the healthcare system is narrower than the health system. And also it describes, in terms of levels of healthcare, the organizational structure of health ministries, departments, and agencies, the provider institutions, the communities in healthcare delivery. It is also not uncommon to hear people talking about centralized and a decentralized health system. You can also note here, is there a difference between centralized versus decentralized health system? Yes or no? Comparing the two systems, the centralized system is a top-down approach. The authority and decision-making are concentrated in one location. It can be in an office or even in a person, and it has a vertical programming. While in the decentralized system is a bottom-up approach. The ownership is spread among many stakeholders or groups, districts, community level organizations. They also have some level of authority over programming, and it is horizontal programming. You can take a minute to brainstorm on who are the major players in the Nigerian health system and what is the linkage between the different groups. For the players, you can look at the public sector and the private sector. You can also look at the ministries of health, the departments and the agencies that have something to do with health. You can look at the partners, developmental partners, we have what they call the multilateral partners. The multilateral partners includes the WHO, the UNICEF, the UNFPA, and you also have the bilateral partners. Organizations like USAID, UK, DFID, the Swedish International Development Agency, and many others belongs to the bilateral partners. Don't forget there are non-governmental organizations, both local and international. You also must remember the professional regulatory agencies, the bodies that regulate professional practice in the health sector. And this includes the Medical Dental Council, the Nursing and Midwifery Council, the Pharmacist Council of Nigeria, and other related professionals have also their regulatory. You must also not forget that there are professional associations, the Nigerian Medical Association, you have the Nursing and Midwifery Council, the Community Health Officers, you also have the Community Practitioners Board as a regulatory agency. You must not also forget there are insurance agencies, both the public and private sector. Don't forget the role played by the National Health Insurance Scheme. There are providers. Providers usually could be institutions, the general hospitals or facilities of various grades, the PAC centers, the tertiary levels. There are also providers at individual levels, the professionals, the doctors, the nurses, the midwives, the laboratory scientists, and many others. What you will notice, don't also forget the local NGOs like Initiative for Health Accountability and Transparency. There is linkage between all of these groups. You can also look at what we call a well-functioning health system. Health system must be functioning well because it's a vehicle which delivers the services. When you have a weak health system, services will not be delivered well. The scenario is also a vehicle that is weak, will not be able to deliver the goods. A well-functioning health system responds in a balanced way to population needs and expectations, including ethics and the rights. It improves the health status of individuals, families, and communities. It defends the population against what threatens its health, usually the public health challenges. A well-functioning health system protects people against financial consequences of ill health. We've talked about what we call a guaranteed financial fairness. It provides equitable access to people-centered care, cares that are focused or centered on people's needs, and it makes it possible for people to participate in decisions affecting their health and the health system as a whole. Let's look at what we term social determinants of health. What are the social determinants of health? They are actually conditions in the environments and always non-health which affect a wide range of health, functioning and quality of life outcomes and risk. They are conditions beyond the health-related conditions, and they are all in our environment. Quite a large number of examples of social determinants of health exist. They include availability of safe housing, food, access to education, access to health services and its determinants, access to education. It also includes social norms and attitudes, things like discrimination against widows, against girl child. It also includes things like racism and overall distrust of the government. Other social determinants includes transportation options, availability of social support, the public safety. It also includes availability of community-based resources that support community living and opportunities for recreation. Other examples include exposure to crime, violence, and social disorder. Socio-economic conditions are very, very important. Poverty is key to health outcomes, and that is why we see a number of social safety nets and poverty reduction measures that are being rolled out by governments at various levels. The role of literacy in health is well documented. Those who are educated or who are literate, who can read and write, have more access to health information. Access to mass media and emerging technologies are very important. Phones and internet and social media today are playing very critical role in health development. And also the role of culture is very, very key and is well documented. How does social determinants of health affect health? We all know that overcrowding is very important in housing to outbreaks. Poor sanitation also very key to outbreak of diseases, particularly potable water and its effect on diarrhea diseases in children. We also note that cooking and exposure to smoke is very important in acute respiratory infection, and quite a number of social determinants you can think about and relate them directly to how they affect health. This is an assignment for the participants on this course online, and is on challenges and emerging health system issues in Nigeria. We have outlined 3 of them: the issues that have to do with inequity and inequality, the issues that have to do with medical tourism, and the issues that have to do with medical ethics, including patients' rights. And we expect the participants to submit online and to be marked LMG assignment of not more than 500 words on the above issues to iheartnigeria@gmail.com. The first issue is, how can Nigeria meet the health needs of the most vulnerable segments of the population? These are the poor, those who live in rural areas. The next has to do with medical tourism, which we see today as a key challenge. It represents a huge capital flight and also undermines the national health service delivery, and it constitutes some security challenges too. So how can the government address medical tourism? And the third one has to do with ethics and patients' rights, and it is, how can health leaders and managers ensure adherence to medical ethics, including patients' rights? Our dream for a strong health system and better health outcomes will remain a dream unless we work for it. And it is important we work for it, because health is wealth. A healthy nation is a rich nation. What is most important and very key is strong leadership, effective management, and transparent governance. And this is what our LMG developing program is focusing on, to facilitate training of health managers and health leaders that will be responsible for developing, managing, and delivering health service that is equitable and very, very impactful on Nigerians. Thank you.